Welcome back everyone. So we'll be discussing about live birth. In previous video we have discussed the definition of live birth, and that is uh, the meaning of live birth is if the child is showing any signs of life when only the part of child was out of mother. So this is the definition of live birth. Only part of child was out of mother. This is the key word. Now there are various signs of live birth. Signs, and these are the signs during autopsy. So there are various signs one has to notify while doing autopsy. First is the shape of chest. Before respiration before respiration chest is flat, but what happens after respiration? Chest is inflated and it becomes uh, arched and drum-like, arched and drum-like chest. Now, after shape of chest, second point is the position of diaphragm. Position of diaphragm. So diaphragm is basically situated at the level of fourth and fifth rib if there is no respiration. But if respiration has taken place, the position of diaphragm will be at the level of sixth to seventh rib. But this position may be somewhere else, and it is very variable, and it may uh, change due to effect of gases as a result of decomposition. So that's why it is not that much reliable criteria. But for checking the position of diaphragm, we have to open the abdominal cavity first. Now the third is lungs. So there are various important findings in live birth fetus, and one has to note all these findings while doing autopsy on a fetus. So first is the volume of lung. Volume. Unrespired lungs appears small and collapsed. So if there is no respiration, lungs will be small and collapsed due to less volume. But fully respired lung fill the pleural cavity, and they are large and fill the pleural cavity. Now, margins of lung. Margins. So before respiration, the margins are sharp. But if respiration has taken place, the margins of lungs become rounded. So round margin if respiration is taken place, but if respiration has not taken place yet, then margins will be sharp. Now the color of lungs. Color. What happens before respiration? Lungs will be uniform reddish brown. The color is uniform reddish brown, or even bluish or deep violet color that can be seen in case of anoxia. But what happens after respiration? After respiration, the air cells become distended with air, and as the air vesicles expands below the surface of lungs, it gives a fine mosaic appearance. Fine mosaic appearance On the surface of lungs, there will be fine mosaic appearance will be seen if respiration has taken place. Now, gas. If air present in the lungs due to respiration, the part of air will be expelled or will rise to the surface as a stream of minute dots. So, on the surface of lung, we can note as a stream of minute dots if respiration has taken place. But in case of putrefaction, the bubbles of gases, multiple bubbles, are seen under the pleura. So these multiple bubbles will be seen under the pleura, and they can be moved from place to place by stroking with the finger. So this is the finding which is seen in putrefaction. Multiple bubbles on the surface of lungs which can be moved from place to place by stroking with the fingers. But if these blabbings are there in interstitium of lung, in the interstitium of lung, these multiple blabs are there in the lung interstitium, it signifies decomposition. It shows decomposition. Now, there are various tests related to weight of lungs before respiration or after respiration. So one test is known as Plauché test. Plauché test. It says that the weight of lungs is almost double from 1 by 70 of body weight. So 1 by 70 of body weight. This is before respiration. But what happens after respiration? The weight is almost double, 1 by 35 of body weight after respiration. So there is changes in weight of lung. That test is known as Plauché test. And this increase in weight is not constant. This increase in weight is not constant at all. So this test is not that much reliable. Now the second test for the weight of lung is Fodry's test. This test says that the average weight of lungs before respiration varies from 30 to 40 grams. So before respiration, the weight is 30 to 40 grams. And after respiration, it is 60 to 65 grams. And the lungs are ligated across their hila and separated before doing these measurements. So these are two tests for for the weight of lungs. Now, one very important test that is known as hydrostatic test. Hydrostatic test, or it is also known as Raget's test. So hydrostatic test is also known as Raget's test. So what happens after breathing? The volume of lung is increased. So due to which their specific gravity is decreased. So after breathing, the volume increases and the specific gravity decreases. So this is the principle of hydrostatic test. Now the specific gravity of lungs before respiration. Before respiration, the specific gravity is approximately 1040 to 1050. And after respiration, this specific gravity is uh, about 940. So there is change in specific gravity before and after respiration. Now, how to do? What is the procedure of doing hydrostatic test? So a ligature is tied on the bronchi and lungs are separated. Each lung individually placed in water. Each lung is individually placed in water. Suppose this is right lung, this is left lung. These lungs are placed in water. If they float, if the lungs are floating, then each lung is cut into 12 to 20 pieces. These lungs are cut into 12 to 20 pieces. If they are floating, then and placed in the water, a small piece of lever may serve as a control. But if the lever floats, the test is of no value because it shows that there is some policy. But if these pieces float, they are each squeezed in between thumb and index finger. So if they still floats, so we'll squeeze them in between thumb and index finger under the surface of water. So under the surface of water is these small pieces, and to see if any bubble of air escapes, and if they still persist to float, or they are taken out of water and then wrapped in a cloth. These pieces are wrapped in a cloth and squeezed by putting a weight to remove the tidal volume, the tidal air. The pieces are again placed in the water. If they continue float, if they continue to float due to the presence of residual air, so they are floating due to the presence of residual air, it indicates that respiration has taken place. So there was respiration, it indicates that respiration has taken place. But if these pieces sinks, these pieces sink after pressure, the respiration has not taken place. But if some pieces float or other sinks, it indicates feeble respiration. So these are various differentiation, whether respiration has taken place, whether there was no respiration or there was feeble respiration. A small piece of lung is rolled gently between the thumb and index finger very near to ear. It, it gives a crackling crepitant noise. Crepitant noise, crackling sound that indicates the significant degree of respiration activity. So it shows that respiration has taken place. So this is something about hydrostatic test. Now the hydrostatic test is not that much significant. It is not of much value because of the lungs of a live bone who have lived for few days may sink, or the lungs of a stillborn may float. So there are fallacies related to this hydrostatic test. Now, what are the conditions in which hydrostatic test is false negative? Like false negative means the expanded lungs may sink. So lungs are expanded, but they sinks. So expanded lungs may sinks. There are various conditions like various diseases like acute edema, and in case of pneumonia can be seen in case of congenital syphilis. So these are few conditions in which the expanded lungs may sink and the test will be false negative. And it can be seen in atelectatic lungs, atelectasis. It is the condition which is seen due to complete obstruction. As more air is being expelled, if the respiratory movements are feeble, so due to expulsion of more air, lungs are atelectatic. So they basically sink and test will be false negative. Now the second is false positive hydrostatic test. It it means the unexpanded lungs float. So positive is seen in putrefactive changes. So if there is putrefaction, then uh, lungs may float due to production of gases, or in case of artificial respiration. As lungs are partially inflated and stomach contains air if artificial respiration has been given to the infant. Now, then the key point is that we don't have to go for hydrostatic test. It means the hydrostatic test is not necessary. It is not necessary. It is not required when the fetus is mummified. If fetus is already mummified, then we don't have to go for hydrostatic fetus. When the fetus is macerated, and in case of monster fetus, because these findings are in itself shows that uh, something has already been done. And if the fetus born before the period of viability 180 days, so period of gestation is less than 180 days, and if the stomach contains milk, then it is more significant than going for hydrostatic test. It shows that live birth was there. And the umbilical cord, if the umbilical cord is separated and scar is there, so these are few conditions in which we don't have to go for hydrostatic test. Now we so far we have discussed various findings of live birth, various changes in lungs, as well as the different tests related to those changes. Now the microscopic changes in lung. What are microscopic changes? So in during microscopy, the thoracic contents are removed intact by Notus technique. So we have to remove thoracic content by Notus technique by cutting at hyla and ligating the both the bronchi, and this is required to eliminate artifacts. And these tissues or lungs are fixed for 48 hours. These are fixed for 48 hours, and then sections are taken of the whole lung in cross sections. So these sections will show various findings at 4 months. 4 months. The parenchyma of lungs is glandular, gland-like structure, and it is having cuboidal or columnar epithelium. So parenchyma is gland-like at 4 months. At the age of 5 months, the air sac contain amniotic fluid. So air sacs are filled with amniotic fluid at the age of 5 months. Now the thin-walled adult type alveolus is formed before term. So alveolus formation forms before term. Now at full term, the normal fetal lung is almost completely atelectatic, but many of its terminal bronchiole and vesicles are partially expanded by amniotic fluid. So full term. Some few alveoli, few vesicles or bronchioles are expanded. The terminal bronchioles or the vesicles are expanded. The rest of the lung is atelectatic. Now, the term fetus, what happens at the time of term? There is respiratory efforts. So, due to these efforts, the alveoli filled with amniotic fluid, and this material, that material is stained with hematoxylin and eosin dyes. It gives the impression that alveoli have been well expanded by air. So they are filled with amniotic fluid, and if it is stained with various dyes, it gives the well developed form of lung alveoli. So these are few microscopic changes of live birth. Now there are various signs of struggle of breath. So there are various signs of struggle, like what happens due to raised carbon dioxide. There is dark discoloration of blood, so blood would be dark color as a result of accumulation of CO2. Now, hemoconcentration. Hemoconcentration increase clots, and these are known as pseudoclots due to hemoconcentration. Now, the child will be cyanosed. There may be tardive spots, multiple pinpoint hemorrhages on pericardium, pleura, and thymus. Maybe sometimes liver congestion may be seen, or congestion of other viscera may be seen. Distension of bowel will be distended with meconium. So these are few signs of struggle while child was struggling for breathing. So these are various signs. Now there are two terms. One is vaginalis, and second is vegetus uterinus. So vestis vaginalis is the child may breathe while its head is in the vagina. While head is protruding out of the outlet, then the child is breathing. And what do you mean by vegetus uterinus? In which the child may breathe while in womb after rupture of membrane. So breathing or crying of child in the womb after the membranes are ruptured. So these are two terms, vestus vaginalis and vestus uterinus. A child may die from natural cause. There may be some natural cause, but it is completely born. The death may be due to some natural cause, even before completely born. So before complete birth, death may be seen due to natural cause. So the the proof of breathing that breathing has taken place is not the proof of live birth. So proof of breathing, there are various proofs of the breathing, that breathing has taken place, and it does not shows, and it is not the proof of live birth. So it is not related to live birth, because death may be seen due to some natural causes even before the child is completely born. Now, various changes in stomach and intestine. So changes in stomach and intestine. The stomach and intestine uh, is removed after tying stomach the same method, double ligature at each end, and they float in water if respiration has taken place. Otherwise, they sink. So this test is similar to the hydrostatic test. This is known as Brislow's second life test or stomach bowel test. This is known as second life test because the previously discussed hydrostatic test is known as Brislow's the first life test. So this is second life test or otherwise known as stomach bowel test. This test is also not much value because air may be swallowed while the child is in attempting to free the air passes and making them free of obstruction. Now another test, that is readiness test. So readiness test is with what happens with respiration, the sphincter at the pharyngeal end of eustachian tube relaxes and the air replaces the gelatinous substance in middle ear. So due to entry of air from the pharyngeal end of eustachian tube and it replaces the gelatinous substance in middle ear, and the middle ear must be open underwater. So if the middle ear is opened underwater by removing the tegmen tympani, the roof of middle ear, and it gives bubbles, multiple bubbles of air comes out if test is positive. So this test is also not reliable. Now there are various changes like there may be meconium staining. So meconium is green viscid substance. It is green viscid substance. It is basically consisting of thickened bile and mucus. So the consistency is bile and mucus, and meconium is completely excreted from intestine or the bowel within 24 to 48 hours after birth. Now there may be various other findings, and these two findings are very important. First is Caput succedaneum. Caput succedaneum, and second is Cephlahematoma. So Caput succedaneum is basically an area of soft swelling that forms in the scalp. So it is an area of soft swelling that forms in the scalp region over the presenting part of head. So what happens in the presenting part of head? Suppose this is a presenting part, and there is some caput is formed, that is a sort of soft swelling. It is basically associated with head molding. During birth, there is head molding, and it corresponds to the portion of scalp surface that is exposed within the opening of dilated cervix. So this is suppose this is the opening of dilated cervix. So it corresponds with the opening of dilated cervix. Now the scalp in case of caput succedaneum is basically swollen in 3 to 4 times of its normal thickness. So skull base is basically swollen, and it is a sort of localized edema and congestion due to local interference of venous return. So actually there is interference with venous return that is responsible for edema and congestion. and it is produced by rigid cervical ring. This cervical ring is so rigid around the presenting part, so that is the main reason for the obstruction of venous return. And most commonly, the caput occurs asymmetrically. There is no symmetrical location of caput over the crown of head in mostly over parietal region. So parietal region is the most common site. Now, the similar swelling occur with breech presentation or buttocks. So if the presentation is breech, then the similar swelling may be seen in buttocks and even scrotums or labia may be involved. So similar swellings may be seen in scrotum or buttocks or labia. Now this kind of collection of uh, Caput succedaneum is disappears within 2 to 4 days after birth. So it disappears on its own within 2 to 4 days after birth. Now the second is Cephalhematoma. Cephalhematoma is basically localized accumulation of blood deep into the scalp. So this is the scalp. So this it is localized collection of blood deep into the scalp between the periosteum and the bone surface. So suppose this is the periosteum and this is the bone surface. So this is the bone surface and this is periosteum. So there is collection of blood over there. Now it is caused by tearing of diploid vein. The diploid veins are the connecting veins. So it is basically due to tearing of diploid veins due to mechanical trauma. So main cause is mechanical trauma, which leads to rupture of diploid vein and collection of blood between the periosteum and the bone. There is collection of blood that is known as cephalhematoma. It is associated with higher birth weight. So if the birth weight of child is high, more chances of cephalhematoma, and it is mostly seen in case of instrumental deliveries. So instrumental deliveries are associated with or there are increased chances of birth trauma. So that's why they are associated with instrumental deliveries also. Now, it is the important feature of cephalhematoma that it is limited to the periosteal sheath of single bone because it is beneath the periosteum. So that's why it is limited. And commonly, the right parietal bone is affected commonly, and the important feature at its as it is limited by the periosteum, so it never crosses suture line. So it never crosses suture line because of it is present below the periosteal surface. Now the difference between caput succedaneum and cephalhematoma. So this difference is also important. The caput is basically the edematous swelling between the skin and galea. So it is due to pressure of presenting part and impaired venous return. So mechanism is impaired venous return. So it is soft swelling due to impaired venous return as a result of pressure of presenting part. But the cephalhematoma is basically localized accumulation of blood. So it is accumulated blood between the periosteum and the skull, and it is due to rupture of diploid veins. Now the collection is basically serosanguinous fluid in case of cephalhematoma, caput succedaneum, sorry, but blood is there in case of cephalhematoma. Now, the the Caput succedaneum is common as compared to Cephlahematoma, but the Cephlahematoma is rare. It is seen in less than 1% cases. So, Caput is basically due to impaired venous return, and it is not limited uh, by suture lines, so it extends across suture line sutures. It never extends, so it is limited by suture line suture lines. The caput is larger as compared to Cephalhematoma. It is not that much large, only 1 to 5 centimeter swelling is there. Now, there is no discoloration in case of caput, no color changes, but discoloration of the swollen site due to presence of coagulated blood is seen in case of Cephalhematoma, and it looks like a bruise. Then it basically caput starts decreasing from birth and fully disappears within 1 week. But the Cephalhematoma not present at birth, and usually it develops after 24 to 48 hours. So it develops later on.